So, do you use email? Okay, because I sent you an email. So, you have one on your profile.
Yeah, mine is too.
You didn't get any last time.
I didn't get what? No.
Yeah. As long as they have
Well, she'll let me know if you've seen anything.
Okay, good. All right.
the chair went back.
What if you failed?
That's okay. Hey, y'all. I hit record, so just whenever you're ready, then, okay. Do you know if anyone else is? I think it's okay to start. All right, everybody. I've been notified that I think we're ready to start. I think there may be a few others coming in. So we'll just let them kind of trickle in and we'll go ahead and get started since there's a good bit of you here. I see some familiar faces from the last education session I did. But for those of you that were not here last time, I'll just do a brief introduction. My name's Allie Brooks. I'm a family nurse practitioner. I did my training at Clemson University, and I have worked at Rolling Green for the last 2 years almost. I serve as a primary care provider in long-term care, assisted living, and memory care. And then I also work in the short-term rehab area sometimes as well. So I love Rolling Green, and I love getting to meet everybody, and love getting to see all of you independent living folks too. And so today we're going to talk about falls and falls prevention. And so this is a pretty important and relevant topic for I think everybody, and hopefully it will be informative for you all. And if you have any questions, you can feel free to ask me them at the end, okay? All right. Can everyone see okay from where they're sitting? Okay. And you can hear me okay? Okay. Let's see if this will work. There we go. Okay. So we'll start with an overview. These are some statistics, recent statistics on falls. So over a quarter of Americans aged 65 and older fall each year, and that percentage increases with age to approximately 35% or 1/3 in those age 85 and older. Almost half of individuals in long-term care facilities or nursing homes fall every year. Falls are more commonly reported in women, and I'll go over that on the next slide. In 2020, emergency departments reported 3 million visits for elderly adult falls. Falls among adults 65 and older caused 36,000 deaths in 2020, making it the leading cause of injury and death. And elderly falls cost $50 billion in medical costs annually. All right, so some risk factors for falls. One of them is history of falling. So falling before puts you at risk for falling again, just for multiple reasons. You know, you could have had an injury, you may have something else going on that's causing you to fall. It's kind of self-explanatory, but wanted to put that in there. Leg weakness, age. So older adults, we just kind of talked about how your risk for falling increases with age. Female sex, and when I was researching this, I kind of wondered, well, why do women fall more than men? And a study that I found showed that women, I guess, when we're trying to multitask, when we're walking and trying to do more things at once, the way that we walk changes more than a man would, his gait. So variability in gait and ambulation puts women more at risk. Cognitive impairment or dementia, history of stroke, which can also cause weakness, certain medications. The most common medications that will put you at risk for falling are those that can cause sedation or drowsiness or dizziness. So antidepressants, anxiety medicine, antipsychotics, and seizure medications also. Chronic diseases, and just a few would be Parkinson's disease, which we all know that affects walking a great deal. Chronic pain, diabetes, heart disease, arthritis, and anemia. Some more risk factors, alcohol use. This alters, your central nervous system's ability to have equilibrium and function appropriately. Footwear, so high heels, backless shoes. It's been found that thin, hard-soled shoes are the best kind for walking, but not wearing proper footwear will put you at risk for falling. Visual impairment, so cataracts, poor vision, glaucoma, not wearing corrective lenses. Low blood pressure, which can cause dizziness a lot of times in older age. we can have trouble regulating our blood pressure, especially when you stand up. So some people may have heard of orthostatic hypotension, which is when you stand up and your blood pressure drops. And a lot of times that will cause falls. Dizziness and incontinence, so needing assistance with the restroom. We see a lot of falls near the restroom or in the bedroom. Residents, trying to get up to the bathroom and tripping or, having an event in the restroom. All right, so all older patients, yes, sir.
The question I have is,
Uh-huh.
they're promoting hearing aids for, about dementia. But the other day, I read an article that said hearing has some bearing on falling and walking. Have you anything on that, that you could, enhance their understanding of that? Is that a proven factor or just a subtle?
Yes, so having impaired hearing can affect your risk for falls as well.
Okay.
Yes, sir. And that just has to do with, being able to interact with your surroundings and, if you live alone, that's another factor as far as hearing goes. You may not have someone there with you, who can assist. Is that kind of what you were asking, if it affects falling?
Well, what they're saying is that in the brain, that there is a relationship with motion.
Mm-hmm.
Of course, that would be in the process of falling, but hearing, apparently, if you're not wearing hearing aids or not able to hear even without hearing aids, it does give you more tendency to possibly fall.
Yes,
Yeah.
that is correct.
That was new to me, I hadn't heard that before.
Yes,
Yeah.
hearing and vision are very important for preventing
Thank you.
falls. All right, so all older patients should be asked about falls at least once per year. Also asked about difficulty walking or dizziness, trouble balancing. And usually your primary care provider would go over this with you. A lot of times they go over it with you at every visit, at every checkup visit. And they say, have you had any falls since the last time I've seen you? And they just want to keep tabs and make sure that if you're having any trouble getting around, that they can find out why and hopefully help you and prevent you from falling. So for those patients who report a single fall or imbalance, a more detailed assessment should be performed. And so we'll go over some of the tests or assessments that your provider might perform if you've had a fall. Okay, so if you do have a fall, you definitely want to notify your primary care provider, and they're probably going to ask you some questions about the history of the fall. So by that we mean, what time of day was it? What were you doing when you fell? Where were you? Did you have any symptoms with it? Meaning, did you have any dizziness, shortness of breath, chest pain? Did you have an injury? Did you hit your head? These are all important questions that they'll go over with you to try and figure out what might be causing the falls and try to prevent them in the future. Some of the tests that screen for your falls risk are the performance-oriented mobility assessment, the get up and go test, the functional reach test, and the short physical performance battery. Some of these are quite in-depth, so I'll just kind of summarize them for you all. The performance-oriented mobility assessment, it goes over balance and gait, and it scales you on a scale of 0 to 10, and then you get a score and they assess whether you're at risk or not. The get up and go test is one of the most common, and so I'll show you a picture of what that looks like on one of the next slides. But what they'll ask you to do is to sit in a chair like one of these. They'll ask you to stand up, walk a certain distance, turn around, walk back, and sit down. And they time you on that, and they watch you do that. and you get a score, and the score, it helps identify your gait, balance, vestibular function. The functional reach test, I don't see this one used as often. I put a picture of it on the next slide just so you could see what it looks like because it's hard to describe. But basically you're standing at a wall, and there's a yardstick next to you, and you're kind of standing sideways, and they ask you to lean over and reach as far as you can. And so they're trying to see how far you can reach without losing your balance. And then the short physical performance battery, that's more of a surveillance scale, and it incorporates again gait, balance, and extremity function. So after they may do a screening for falls, they'll examine you and look at your blood pressure, your heart rate, your vision and hearing, like we talked about, and your neurologic system. So making sure that your strength is the same on both sides, that you're not showing any signs of a possible stroke, and making sure that your blood pressure is not too low or too high, and same thing for your heart rate. They may also order some lab tests. This is not always the case, but it can be. A lot of the times we'll look at your hemoglobin to make sure you're not anemic, which can make you feel weak and put you at risk for falls. Kidney function, blood sugar, make sure your blood sugar is not too high or too low. Vitamin D, which we'll discuss a little bit more later. Vitamin B12, magnesium, and thyroid function, or TSH. All of those labs can affect your balance and your falls risk. So there's the functional reach test I was talking about. And so that's kind of what it looks like. Again, I haven't really seen this one used very much, but it is one that came up in my research. And this is the get up and go test, which is the most common assessment. So they ask you to stand, walk, turn, walk, and sit down. All right, potential complications of falls. We all know fractures can occur. More than 95% of hip fractures are caused by falling. So unfortunately, that is something that I see a lot. Most commonly from falling sideways. And other common fracture sites include wrists, ankles, and arms. One that I didn't mention there would be leg fractures. So sometimes you can also have a femur fracture, and a lot of times that can happen along with a hip fracture, unfortunately. Head injuries. Head injuries require urgent evaluation. So if you fall and hit your head, you definitely want to at least call your doctor if you're not sure if you need to go to the emergency room or not. There's an increased risk if you are also on blood thinners. So if you have atrial fibrillation or you've had a stroke in the past and you take medication like Eliquis or Plavix or Coumadin and you fall and hit your head, you do need to get checked out because you're at a risk of having a bleed in your brain. And then falling a lot of times causes anxiety about walking and fear of falling again. So a lot of times patients might be doing really well and working with therapy, and then they have a fall and it really sets them back because they're scared to walk on their own, or they're scared to participate in therapy. So definitely hinders recovery and improvement in balance. All right, so what to do if you fall? This may seem self-explanatory, but there are a few good tips here I wanted to go over. So first thing would be to try and take some deep breaths and compose yourself. So you want to be able to kind of think clearly, decide if you've had an injury, and then if you have had an injury but are able to get up, you want to crawl to a sturdy chair and get up using your knees and hands and sit in the chair. And once you're in the chair, you want to sit there and rest for a few minutes and kind of let your blood pressure even out before you try and get up again. The main thing would be, if you can't get up on your own, calling for help or dialing 911. And the main takeaway from this is, if you do live alone, it's very wise to look into like a pendant or a life alert that you can press in case of emergency, in case you cannot get off the floor to call for help. And that can also be important even if you do live with somebody. And other than that, making sure that you have a phone that's well charged, that's available to you at all times, that you can get to easily in case you need to call for help. All right, so falls prevention, we'll go over some things that you can do to prevent falls. The first main thing would be using appropriate assist devices. So cane, walker, wheelchair, not trying to forgo those measures, you know, if you're in a hurry, but always being careful and using the equipment that's been recommended for you. Environmental modifications, so chair and stair rails, bathroom grab bars, keeping your rooms well lit so you can see, slip resistant surfaces, and non-skid bath mats. Again, a lot of falls happen in the bathroom, so being careful there. The next would be vitamin D supplementation. It's one of those labs that we do check if we notice that you're having a lot of falls. And that's because vitamin D helps with bone health. So we want to make sure that we're keeping your bones as strong as they can be. So 1,000 units of vitamin D daily is recommended for those at risk for falls, and that can be bought over the counter at any pharmacy. And treating deficiency lowers the risk for muscle loss, decreased strength, and hip fractures. Oh my goodness. I'll try and finish, so y'all have to go outside. It's not too bad. Annual eye and hearing exams, very important, like we talked about. It was a very good question. Osteoporosis screening, so making sure you get your DEXA scans done. I know it's one more appointment to go to and one more thing on the list, but it is important because if your doctor detects osteoporosis, they can help you treat that and help your bones stay strong. You want to go through slow transitions when you're getting out of bed or getting out of a chair. So stand up slowly, that helps your blood pressure kind of even out. Keep your hands free and look where you're walking. I know that a lot of us have cell phones and we get kind of busy, but you want to make sure that you're keeping your hands free when you're out and about. Medication modification. So if at all possible, we like to avoid or reduce medications that can cause dizziness or sedation. So again, these are things like antidepressants. Those come with a label for dizziness. You might even notice it on your bottle from the pharmacy. It usually says, warning, this may cause dizziness. Anxiolytics, which just means anti-anxiety medicine. Things like benzodiazepines, such as Ativan, Klonopin, Xanax. Antipsychotics, which some patients take who have dementia or a psychiatric diagnosis. That would be something like Seroquel. And then anti-epileptic medications or anti-seizure medications can also cause drowsiness as well. And those would be medications like Keppra or Depakote. exercise. This is a really good way to prevent falls, but participating in exercise for 3 hours a week, and the type of exercise that's recommended is something that combines strength and balance. So yoga, Pilates, Tai Chi, dance, aerobics, stair climbing, lifting weights, of course not too heavy weights, but mild weight bearing activity can be beneficial as well for bone health. And that is what I have for y'all today. So do you have any questions? Yes, ma'am.
This polished wooden floor
Yeah.
seems to trip the staff as much as the residents.
Yes.
And it trips me a lot. I've fallen and gotten hurt.
Okay. I can definitely bring that to the facility leadership and let them know that there's concerns there. I agree with you. I trip sometimes as well.
It seems to catch the rubber soles.
Yeah. Yeah. It sounds like everyone's kind of in consensus there.
Yeah.
So
Drop like flies.
yeah, we don't want that to happen. I'll pass it along for you. Yes, sir.
Repeat the question for us that are hearing impaired.
Yes.
Repeat the question. When someone asks a question,
Oh,
repeat
okay.
the question.
I'm sorry.
Thank
She asked, or she kind of just made a statement that the floors out there, the wooden polished floors, are very slick. And that she's noticed that she's tripped and that other people have tripped, even staff members.
Thank you.
Mm-hmm.
I find it that when I wear my tennis shoes, they have those wedges across them,
Mm-hmm.
they'll catch your toes.
Yeah.
Leather shoes, oh, don't do that.
Yeah. Are your tennis shoes, do they have a thick sole? Yeah, sometimes the thick soles tend to catch more and trip you up. So thin, hard-soled shoes are the best for balance. So it sounds like your leather shoes might be best for you. Even though we think tennis shoes should be very supportive, you just gotta be careful. Yes, sir.
Yeah, most of what we talked about is prevention of falling. Do you have any recommendations about how to fall at our age?
How to fall. Okay, so he said, do you have any recommendations about how to fall? Well, the first recommendation is I don't recommend it. But if you do fall, usually it's never ideal, but if you can kind of try and catch yourself and avoid hitting your head, that would be best. You can, yeah, and if you try and catch yourself, you can break your wrist, but it could be better than hitting your head. So if you can kind of lower yourself to the ground at all and kind of fall on your seat, if you're falling forwards, you may not have any option but to try and catch yourself. But if you're falling backwards, you want to avoid hitting your head. Does that help?
Yeah, land on your butt if you can.
Yep. Mm-hmm. Yes, ma'am.
I always fall backwards, but why is that?
If you always fall backwards, well, that would kind of depend on a lot of things. So, we'd have to talk about what's going on at the time and go through a risk assessment like we talked about and talk about, your chronic conditions. But, it could be a multitude of things. I'm not sure where they're occurring or.
That's safer than forward, right?
Well, not if you hit your head.
That usually comes forward.
Yeah, I'm sorry for the feedback on that. Yes, ma'am.
It seems as though when I've experienced a fall, it's like I'm on the floor before I know I'm there.
Mm-hmm.
I mean,
Yeah.
how can you prepare to fall for it? You know what I mean?
You can't really. The main thing is just trying to, have as composed recovery as you can. So like you said, it usually just happens in the blink of an eye, and next thing you know, you're on the floor. And the main thing is just trying to compose yourself, figure out if you've had an injury. Because if you have had an injury, sometimes moving will make it worse. So you first want to figure out, should I get up? Should I stay and wait for help? But unfortunately, there's not really a great way to prepare for it.
I guess the preparation is to know what areas to protect, like you said, you had a head and the wrist.
Right.
I mean, I have actually mid-air twisted so that my butt would hit the ground.
Yeah. Yeah, that's really the only things that you can do. And like I said, having a phone nearby, having your surroundings well lit, knowing who you can call for help, preparing as much as you can with environmental modifications. But of course, none of us can prevent an accident, so.
Could you repeat the questions again?
Sure, I'm sorry. She just said, a lot of times when you fall, it just happens, and before you know it, you're just kind of on the ground. So we were just kind of discussing back and forth, if there was any way to prevent that. Yes, ma'am.
I would say wearing your pendant would be important.
Yes.
I would say another thing is when you get up from one position to another, if you just hesitate
Yes.
rather than just do it quickly, because if you lose quickly, you lose your balance, but
Yes.
if you mentally get yourself ready for the move, you do it better.
Yes. So she just said wearing your pendant is important and getting up slowly, like we talked about. Which is all great advice. Yes.
I have a question about antidepressants.
Mm-hmm.
Can that affect your balance?
Yes, it can. Not all people who take antidepressants have that side effect where they get dizzy. But it can cause you to be dizzy and off balance. A lot of times you'll notice that either when first starting the medication or, if you're trying to come off of the medication. A lot of people experience it when there's adjustments being made. Mm-hmm. Yes.
Another thing to consider is, and you mentioned this, when you get up on the chair or get out of bed, pause and let your body normalize before you make any movement, and that is very important.
Right.
Because that quick movement, you're subject to falling.
Right. And he said again, it's important to let your body normalize when you get up. Anything else? Yes, ma'am.
I read an article recently on falling.
Uh-huh.
It says if you feel like you're falling, cross your arms and fall on your arms, and that way you don't risk breaking an arm or
Yeah. I haven't heard that one yet, but that's a good idea.
I think I still got the article.
Yeah, I would love to read
That's
it.
really interesting.
Yeah. Yeah, that would be great.
We couldn't hear.
She said she read an article recently, and it said if you think you're gonna fall, to cross your arms like this. And yeah. So, I said I haven't really heard that one specifically yet, but in theory, it sounds like a decent idea. Anything else? Mm-hmm.
I have one more question. When it comes to hearing, like I'm very deaf and gonna have surgery in 2 weeks, but how does that correlate then with your imbalance or your falling? Is it a risk?
Yes, so she asked, how does hearing correlate with falling if you're hard of hearing? So it has to do with sensory deficit. So, obviously not being able to hear, you're at risk of, not noticing things in your surroundings, which puts you at risk for falling. Yeah. Any other questions? Okay. Well, thank you all for coming. It was nice to have you all. I hope you have a good rest of your day and stay inside if it's raining.
But you know what, my physical therapist, I hurt my back a while back. She was telling me.
That's right.
I'm wondering if the program that did that, and how to get up there. But I think sometimes on physical
Get a hip fracture on a replaced, or do I have to worry about this non-replaced side? This one has, this one has not. You ready
I just what they do with me.
Well, let's keep in touch.
They ship them back to the ocean.
I made it just in time. All right. It doesn't look like, but I'll let you know it doesn't look like it is. Well, thank you. You're not gonna fall down.
No, I try my best, I don't know.
Just take it slow. Take it
Having an art sport is hard to find. Have you been to like a orthotic rather than kind of fitting right now? Usually they're like the specialty shoes. Like around
Your shoes ever catch on?
And then the others, they catch them to catch and they're broken out.
I've had to rely on that slow. Sometimes
I haven't a tendency to walk fast. I need to be able to walk slowly and pay more attention.
yeah, I know. Well,
You're looking so
she has a good background, and she bought them at the store.
Oh, anytime, you can call us. 11:45. We get out of church at 11:30, and we can make it right there.
Running and things like that, but I don't know. Before you make a big purchase. Skechers are pretty good. Skechers usually are.
Well, you take care, if you need anything anytime, let us know.
Yes, Mr. Rister. Because I know you. Because I took care of your wife.
That's okay. I saw that in there yesterday, I thought, I'm gonna call Janelle. But it's already, it's inspired me to call.
Yes, that's something that was
I should have taken it out after I sold it. Yeah. Well, that's a good I have now. I got to talk to you. Yes, that's right. Yeah.
Well, be careful.
Yep.
I guess you're parked out back. That's from, I'm parked out here in the back.
As far as, are you asking about dehydration? Right, you can stay hydrated. I would follow up with your doctor and make sure that they don't adjust your blood pressure.
Okay, bye.
Sit
next to
You do? You're so right. But if you're dehydrated,
Okay, how many bottles of water?
yes, you wanna have at least 8 glasses of water a day. Or an electrolyte drink. Well, tea and coffee I wouldn't count, because it can actually dehydrate you. But water, juice, electrolyte drinks like Gatorade, those all count. Yeah. Sure.
Hey, Mr. Mitchell, how you doing?
Yeah. Oh, okay, cool.
No, what I walked this morning and I saw you in the distance.
Yes.
Yeah.
And I walked, oh, this girl's the name.
Yeah, absolutely.
I was thinking,
It goes over the backwards and
how long?
Well, you know, like I say,
I thought I'd never do this again in my life.
Sure, that would be wonderful.
30 years ago. Oh, boy.
That is so kind of you.
And then after a while, I wake up automatically, I know that. I said it, 6:30, but don't call me at 6.
Thank you so much. I love pickleball.
Yeah, I know, but it is my gym day. That's your particular exercise. Okay, that's good.
Oh, yeah.
Uh,